Assalamu alaikum friends, welcome to my channel Medical Lectures and Mnemonic. So today I'm going to talk about a very important topic which is called pediatric history taking. But before pediatric history taking, I have recorded a video on pediatric terminology and you should know about this terminology, and this terminology are frequently used in pediatric history taking. So in the previous video I have talked about that the correct diagnosis of a patient disease requires three things. One is the history taking, the other is investigation, the other is a physical examination, and the third is investigation. And the history taking will guide you that which area of the body is to be examined and which investigation should be done in order to diagnose the disease. So the pediatric history is actually the history from the child patient, and the history taking pattern is same in all type of from all type of patient, like whether it is a gynae patient or it is orthopedic surgery or any other patient, but there are minor differences. For example, in pediatric history taking, we sometimes can't take history directly from the child because some child are unable to talk, and we usually take history from the child attendant, like the child attendant maybe his or her mother or maybe his or her sibling or any other family member. So the first thing is approach from the right side of the patient. Introduce yourself. That I am Dr. Falafala. I am going to inquire about the disease of the child. And so the first thing is biodata. Ask about the name of the child, his or her age, sex, resident, date of admission, DOA mean, date of admission, MOA mean, mode of admission. The second thing is chief complaints. The symptom to which the child is presented to the OPD or emergency is called chief complaints. And the chief complaints should be in chronological order. For example, if a child is presented to the OPD or to the emergency with abdominal pain from the last 5 days and diarrhea from the last 2 days, then you should first the abdominal pain from the last and right in front of the symptom, the duration of the disease, and diarrhea from last 2 days. So you should write like this. This is called chronological order. The third thing in history, pediatric history taking, is history of chief complaints. In history of chief complaints, we actually elaborate the chief complaints one by one. For example, if a child is presented to the OPD or to the emergency with abdominal pain, then describe the pain, that what is the onset of pain, what is the severity of pain, and what is the site of pain, and as the pain is radiating or it is localized, is there any aggravating or relieving factor for the pain, and is there any associated symptom with the pain. So there in history of chief complaints, elaborate the chief complaint one by one. Now the fourth thing, the birth history and pediatric history. These three things are different from other history. One is the birth history, feeding history, immunization history, and developmental history. So in birth history, we actually ask three things. One is the antenatal history, the natal history, and the postnatal history. In antenatal history, ask about the health of the mother during pregnancy. For example, she suffer from any chronic illness like diabetes, hypertension, any type of infection like tuberculosis, syphilis, or is she taking any medication? If the answer is yes, then ask about the type of medication she is taking, and their dosage and dosage form. And the second is the natal history. In natal history, ask about the period of gestation or the duration of gestation, which is normally about 37 to 42 weeks. So the second thing is the place of delivery, whether the baby is born in home or it is in hospital. And then duration of labor. Example, the duration of labor is normally 8 to 12 hours, but if the duration is prolonged, then it may present some diseases like cervical stenosis, etc. And ask about the mode of delivery. For example, it is spontaneous or it is attended by any die. So the third thing in birth history is postnatal history. In postnatal history, we actually inquire about the any information or information during delivery. So ask about the in postnatal, the cry is the cry of the child was immediate or it is delayed. And ask about the child is respire. If the respiration is delayed for more than 5 minutes, it may represent the birth asphyxia. Then ask about the birth weight, the birth age. Now the feeding history. In the feeding history is more significant in those whose age is less than 2 years. So in feeding history, ask about the when did the child start feeding and what type of feeding is given to the child. For example, if the child is breastfeeding or bottle feeding. If the child is bottle feeding, then ask about which type of milk is given to the patient, and ask about their frequency of feeding. And immunization, normally the child attend and have immunization card or vaccination card. If she or he doesn't have immunization card, then ask about you have visited the vaccination center. If the child is vaccinated, for example, is if the child is vaccinated, and ask about the type of vaccination he or she received. And is the vaccination completed or incomplete, is booster dose or not. Then ask about the developmental history. In developmental history, we normally inquire about when did the baby start the first mile, in age at which he or she is able to hold his neck and work with or without support, and stand with or without support, etc. So this is the developmental history. And past history, normally the birth history, feeding history, immunization history, and developmental history are all included in the past history. In the first history, also ask about that whether the child is suffering from any illness like fever, cyanosis. In family history, ask about the parents' health. Ask about the parent health, his or her sibling, and the sibling age and their sex. Is there any death in the sibling of the child? If the ask about the death cause and any miscarriage. In social history, ask about the parent education and occupation, and ask about their income, and ask about the house they live. In personal history, the personal history of the child is that ask about the special habit of the child, detail of class he is going to the class, and detail of school he is going to the school, and interest and study, and ask about the behavior of child at school and with others. So this was all about the field history taking or pediatric history taking. So for more video, subscribe, like and share, and thanks for watching the video.